Good afternoon. My name is Karen Ayala, and I serve as the Executive Director at the DuPage County Health Department. I'm here with another weekly update on DuPage County's COVID-19 vaccine distribution. As a reminder, the vaccine goals or the vaccination goals in DuPage County are predicated on reaching 80% of the adult population to be fully vaccinated by July 1. In order to do that, we anticipate needing to reach 572,000 individuals. And as of March 23rd, over 230 individuals have received at least one dose of the COVID-19 vaccine. Also, as of March 23rd, we see that 134,219 DuPage County residents are now fully vaccinated with the COVID vaccine. When we look at the number of people in the 1B priority group, which was where we're at today, we know that there are about 270,000 individuals in that pool of people who are eligible for the vaccine. Meanwhile, we're receiving on average about 14,000 doses per week. This week, we saw that increase to 23,490 first doses. However, this has been extraordinarily variable, and we'll get to that in a minute. So please know that as we work to vaccinate all individuals who are eligible within DuPage County, we have the capacity to make much quicker strides in our efforts. However, what we're lacking is the actual vaccine to provide to individuals. In fact, last week we had 36 vaccine providers who wanted to and registered for more than 55,000 doses, realizing that they had the ability to provide that much vaccine. However, our allocation from the Illinois Department of Public Health was only 16,070 first doses. So clearly, we're only able to vaccinate if we have the vaccine. We continue to work with the county and the state to advocate for more vaccine for our residents. And this week, we were able to increase the number of vaccines to our residents and all residents of Illinois through our Mass Vax Clinic, our community vaccination site here in DuPage County. This current week, we have an allocation which reflects that increase of vaccine available to us. It stands at 23,490 first doses. When we reflect back to last week, we have had an increase of 58,000 doses administered over the course of the last 7 days, with an increase of over 21,000 individuals who are now fully vaccinated. What that represents is 14.45% of our total population. This is everybody in DuPage County being fully immunized, which has been increased by almost 3% over last week. So we continue to track our vaccine efforts, and you will see on the graph on the right side of this slide that there's a slight downward trend in the administration of vaccine per day that we're experiencing. I want to assure all DuPage County residents that the reason for that decrease is because, again, our doses have been limited. We can pump that number up significantly once we get doses freed up. You will see that in DuPage County, we continue to lead the collar counties with the number of individuals who are fully vaccinated. Again, these are the people from DuPage County who are vaccinated, not necessarily the people who have been vaccinated in DuPage County. When we look at some of the breakdown in demographics, we continue to see that we have some work to do around equity issues with our race and ethnicity percentages. you will see that the age demographics are beginning to trend slightly younger. And when we look at our male-female percentage, you'll also see that we have a growing number of males who are now eligible and receiving the vaccination. This number of the 65 and over represents what the Illinois Department of Public Health has to provide us with data, that 60,483 residents of DuPage over the age of 65 are now fully vaccinated. That's very close to what we have according to our records locally in DuPage County, with over 38% of persons over the age of 65 years old being fully vaccinated. According to our estimates, there are 154,474 persons over the age of 65 living in DuPage County, and increasing the number of individuals who have received that important first dose to over 100,000. So we're now almost to 65% of seniors over the age of 65 who have received one dose. These doses are provided, again, in DuPage County through a variety of partners. So it could be that you're getting doses at a hospital clinic. It could be that you're going to a pharmacy. It could be your outpatient provider, or it could be at your work site, or ultimately it could be at the DuPage County Health Department's community vaccination site. All told, we have 164 sites within DuPage County who have been approved to handle and administer the vaccine. This is a breakdown of the type of providers that we have. And this graph represents the distribution from a geographic standpoint. When we look at the right side of this slide, you see that we have a slightly more Moderna first doses that we have received in DuPage County over Pfizer, but the numbers are very closely aligned. Again, this data is reflected at our website, and if you'd like to drill down and know exactly where these doses are going to on a weekly basis, that information is provided to you on that website. A reminder, and I've talked about this when I talked about the vaccines and the need for more doses of the vaccine. In DuPage County, we have a network of providers who could be providing 65,700 doses a week to our residents. If you recall from my earlier slide, this week we're receiving approximately 23,000 doses, which is close to the all-time high. We have an average of about 14,000 doses per week. And so you see that significant mismatch that we have in our ability to push the vaccine out. But we do have sites ready, staffed, and able to put vaccine in people's arms. Not only do we have sites in DuPage County, but because of the constraints of the doses available to us, we wanted to make you aware of some sites in the region that are open to all Illinois residents. These are sites that have been approved and receive allocations from the state of Illinois for additional vaccine doses and can be utilized by any resident of the state of Illinois. So what you see here are the vaccine sites that are kind of regionally close to DuPage County. But again, if you want to check on our website, there are other sites available throughout the state for individuals who are able and willing to travel to get their vaccine. We understand that it is an additional barrier or challenge to have to travel. We absolutely recognize that, and again, that's one of the reasons why we're working so hard to get more vaccine to our residents. When you look at this chart, though, you see the ups and downs, the swings of the doses that we have received. So we started out with 13,000. We hit the 23,875 high, and then we plummeted to 2,450 doses. We're on a increase again. We've increased every week since that time up to almost our previous high. But now next week and the following week, you'll see a significant decrease. Again, the orange lines are estimates only and are provided to us for planning purposes. However, it does reflect the reality of the rather dynamic and unstable vaccine supply that we're addressing. This slide reflects the doses coming in. The blue line reflects the doses coming into the state of Illinois. The orange line reflects the doses coming to DuPage County. Once it gets to DuPage County, again, you can see where the vaccine is distributed by provider type. Again, this week, the vast majority of the vaccine is going to our hospital partners who are operating large mass vaccination sites. But also, we have our public health clinic, we have urgent cares, we have independent pharmacies, family medicine, medical practices, amongst the vaccine providers who are administering and continue to administer the vaccine. Again, this is just a small snapshot. We have 164 providers who would be thrilled to provide the vaccine to our residents and understand the importance of getting our residents vaccinated. Again, we're held up by the constraint of the vaccine supply. As you'll recall from last week, the vaccine supply emanates from the federal level. The federal level provides an allocation to the state of Illinois. The state of Illinois then allocates it further, and ultimately it ends up into the different providers throughout DuPage County. Again, I want to point out that this is an allocation, it is not an order. If we were ordering vaccine, we would have ordered 55,000 doses last week. Instead, we're provided with an allocation, or in other words, told how many doses we can receive, and that allocation was less than a half of what we would have ordered. With vaccine supply being in such short supply, we're really working hard to make sure that we address the disparities that we have seen both in health outcomes related to COVID and the underlying factors that are related to some of those disparate health outcomes. So we have utilizing the CDC's framework of the Social Vulnerability Index. We have mapped out, and the darker the blue, the higher the rate of vulnerability for these zip codes throughout DuPage County. And we have worked with our partners. In fact, our partners are prioritized by their ability to reach into the pockets of these vulnerable populations throughout our county to make sure that vaccine access doesn't simply go to individuals who can drive 4 hours or who have the means to be able to even, we've heard stories of people flying to other states to receive the vaccine. We want to make sure that in DuPage County, every resident who wants a vaccine gets that vaccine. Again, these are the considerations that we use when we're allocating or evaluating the vaccine to our providers. We want to make sure that the vaccine is reaching the communities that have the greatest need and the most barriers. Finally, I'd like to just address this chart, which we've used since the start of our vaccine planning, and it breaks down the different phases. We know that we are at least 70% of the way through our 1B population. The state of Illinois added a 1B plus. In essence, they carved out some individuals who were in 1C and pushed them over to 1B. We are looking at the opportunity to start vaccinating that 1B population, particularly individuals between the ages of 16 and 64 years old who have underlying chronic health conditions. We will begin to vaccinate those individuals. Again, it's about 180,000 residents of DuPage. We don't have enough vaccine to get to everybody the first week, but we will begin to vaccinate that population next week. And then the governor has indicated that by April 16th, everyone who wants a vaccine will be able to register. Another way that we have made sure to address the equity and access issues throughout our county is through our HEART coalition. And HEART stands for Health Equity and Access Response Team. It's been a group that has been meeting since October 2020. We have over 40 representatives on this group that meet in a routine basis, making sure that there are strategies and efforts to address vaccine confidence or vaccine hesitancy issues, making sure that individuals who may speak a different first language are able to understand and have access to the information about vaccines and vaccine safety, as well as making sure that the vaccine is actually brought to communities and embraced by communities who may not be as eager to receive the vaccine as others. That, along with our communication tools, which again are all in Spanish and English and available on our website for anyone to pull down, use, distribute widely. Communication has been one of the primary strategies that we have used at the DuPage County Health Department since the beginning of this pandemic, and we will continue to use these communication tools and really invest in opportunities to spread accurate, reliable information to our community. With that, I want to thank you once again for the opportunity to share this update. And as you have questions, please send them to this email address. Thank you again for your time, and I look forward to our next update. Thank you.